And welcome back to the show. Now, if you're just tuning in, we've been talking about ways that you can get the most out of your life this year by taking control of your health with Dr. Christine Lee. She's a doctor of pharmacy and the creator of Optimal Life, a program that consists of easy-to-use, self-educational books and DVDs that empower individuals to become better educated about their own healthcare needs. And we're going to welcome back Dr. Lee. As mentioned, if you're just tuning in, we were talking about diabetes, and we've been hitting on all the complications that can come with diabetes if you don't gain control of it. So how do our viewers do that? How do they gain control?
Well, first, they need to know what their goals are that their doctor has picked for them for their blood pressure, their glucose, as well as all their cholesterol levels. Next, and the most important thing is you need to know your numbers. You need to know what your numbers are now and get measured for your blood pressure, your blood glucose, as well as your cholesterol levels. If your doctor's goals and your measurements are too far apart and they do not match, you are not in control.
Okay, so it's bad then, or there's a problem if your results don't match your goals.
Absolutely. In fact, the further your results are from what your doctor says are your goals and your measurements, the greater chance you have of having complications with diabetes. In fact, let's take an example of heart disease, because we know people with diabetes have a 2 to 4 times greater chance of having heart disease. If you don't know your cholesterol levels, your cholesterol can build up, and as your cholesterol level builds up, a plaque forms in your artery, and that plaque can break off and block the blood flow and give you a heart attack. That is why it is so important. You need to know your goals as well as where you are in your measurements so you can work on them to get in control.
And as we've been talking about getting control of your life, it sounds like to me that if you're going to be invested like that and you really take control of your health, that it has some very powerful results.
Absolutely. And I hope they're going to put up a picture right now, because one of the persons I've worked with, he was 325 pounds. He got down to 210 pounds. And when he was 325 pounds, he was diagnosed with type 2 diabetes. He had high cholesterol. He was also diagnosed with high blood pressure. He had a family history of heart disease and was put on many medications. This scared him, and he knew he had to get control. So he took the information, started working on his health. He goes to the doctor regularly. He gets his tests done like clockwork. He exercises, and he is off all of his meds.
Wow, that's a great story.
Right.
And it sounds really important that you get those tests done, but how do you know where to begin? How do you know what you need to get done?
Well, again, the DVDs and books have charts that you can take with your doctor that explains and go in more detail why these tests are so important. But what I say to the patients that I work with is that there is an easy way to remember, and I say, if you can remember ABC, MD, foot and flu, that tells you the most important test you need to have. So the A stands for an A1C glucose test. The B stands for having your blood pressure done. The C stands for getting cholesterol and creatinine. The D is for diabetic eye exam. The M is for microalbumin, which is protein in your urine, which is really important, you need to check. Foot is you have to get a diabetic foot exam. As well as flu, you need to get that flu shot every year to keep you healthy.
Wow, that's a great thing for people to kind of keep in mind and carry with them. So what's the most important message, though, that you want our viewers to walk away with when it comes to taking control of your health?
The most important message is you have to be proactive. And being proactive means taking control of your diabetes, because the complications of diabetes are life-threatening. So you really need to watch and take care of yourself. Now, in Optimal Life, we talk about when you get control of your health, you can start living life to the fullest. And getting control of your health enables you to do the things you want to do. And that's how we want everybody to be, because your disease should not stop you from doing what you want to do. Because I always say, you deserve an optimal life, and we really believe it, and you can have it.
And where can people find your products?
They can go on the internet. It's optimallife.net, And again, for today, there's a special that when they check out, if they use OPT1, they can get a 15% discount.
That's great. Dr. Christine Lee, thank you so much.
Thank you.
Greatly appreciate it. So much information, and I really hope our viewers take advantage of that and start living the life that they deserve.
Absolutely.
All right.
Absolutely.